Hey, good afternoon. Dr. Alan Christensen here with you. Nice to see you all. We've got a really good group here with us. We've just about filled Zoom. Joanne, you were up on top here for some reason. Good to see you. Seeing a few other names top of the list here. Aisha, Amy, Cynthia. So yeah, we've got a bunch of folks on, and we're just about to fill up the Zoom space. So I'm glad you guys got on early. I'm glad you got to make it. So this is our third in a three-part series about how to lower thyroid antibodies. And it's been a real great journey. I've learned a lot, and we went deep into diet on the first one and talked about the role of medications and what they can do to affect thyroid antibodies. And now in this one, we'll talk about supplements and relevant micronutrients. So I started exactly on time. We're 4:01. I'll give a minute or two before diving into it in too much depth, because I've seen a lot of folks coming on still. You know, we have time zone differences, and I was on Instagram briefly earlier today, and someone was saying how they liked that time rather than later. They were on the East Coast. So those of you on the East Coast, this is 7 o'clock. If I were there, that would be getting close to bedtime. So if you're with me at some late hour, I appreciate that. I respect that. I honor your time, and wherever you are, just taking the time to come on here live. I appreciate it. It's nice to connect in person. We'll talk for 30, 45 minutes or so about thyroid supplements. I'll grab some live questions. We get to do those in real time on video, and we'll call it a night. But I'm excited. There's a lot of really good data to share, and put a lot of work into preparing this presentation for you guys. I'm seeing tons of comments coming in already. Totally cool in the chat. You're welcome to do that. When we do get to Q&A, the most helpful process for that is to raise your hand. And yeah, if someone wouldn't mind just mentioning in chat how that process works, because it looks different when I'm the host as it does for those who are participants. So Robbie just raised their hand. Robbie knows how to do it. And when we get to Q&A, I'll see a list of raised hands in order, and I'll go through and get several of those in order. We'll get to as many as we can tonight. So lots of hands going up. Okay, so a bunch of folks coming on still, but 4:03, what do you guys think? I think we should get started. We gotta respect those who came on time and get the ball rolling. So we'll do that. All right, Dr. Alan Christensen, welcome. We're gonna talk about how to lower thyroid antibodies. And if I can get, Joanne, you're on top again. Can you give me a quick nod? Are we seeing the proper slide, how to lower thyroid antibodies on the PowerPoint? Is that what's showing up? Thank you so much. All right, so we'll roll with that. And this one's about supplements. Now, I want to briefly recap the relevance of thyroid antibodies for those who may not have been here at the others, or for those who may not have remembered what that was about or why they can be important. And before I do that, here's just some really top insights. And overall, there's encouraging data that supplements can lower thyroid antibodies by about half, maybe a little bit more. And the ones that have the most data on them are Selenium, Inositol, and Nigella. And I'll talk about all those in really good detail. So what we'll cover tonight, like I mentioned, we'll start with the basics about the thyroid antibodies, what they are, what they do. Does it help to lower them? Some cases, it probably wouldn't make a big difference for some people per their goals, per their antibody levels. But for many, it could be quite important. It could be the biggest barrier to improve one's symptoms, help health outcomes, and to assure longer-term lower rate of disease risk. It could be a big deal. And we'll talk about the ones that have the best data behind them and how to use them, how to make sense out of that. So let's do it. Okay, so next up, what are thyroid antibodies? Well, autoantibodies, or just antibodies. So antibodies are things that are made by the immune system that identify something foreign. You know, I always imagine this as like ships with flags, like you've got the pirate's flag and you've got the Navy flag and whatever else. So down in the microscopic world, there are these surface markers called glycoproteins. And yeah, think of them like flags on a ship. Basically, they let the little tiny things like the immune cells or the infectious agents know who's who, you know, who belongs, who doesn't. And antibodies are formed at specific foreign compounds called antigens. So a classic example, you could breathe in pollen. And if you're someone who's unlucky enough to make a lot of antibodies against pollen, it could make you sneeze. It could cause some reactions. So on the other hand, if we make antibodies against mumps, say we had mumps as a child or we were vaccinated, we then make antibodies. And then in the future, we can quickly identify and eradicate this infection before it could harm us. Now, the whole thing can go wrong when we make antibodies against our own tissues. And this is how thyroid disease emerges. And this is by far the most common form of autoimmune disease in general. So let's get into how the thyroid makes hormone, and the antibodies are just a part of that. So here's this little red glob that I'm marking on here, this thyroid follicle, and this little box, this square. The rest of this is that square blown up. So this is right here, one little cell right there on the border of the thyroid follicle. So this white space is all the outside, the red is the inside, and that's where we make the hormones. So here's a blood vessel right outside the cell, and the blood vessel allows iodine to get absorbed. It also allows tyrosine to be brought inside the cell across the membrane. Tyrosine is made into this protein called thyroglobulin. We'll talk more about that. Iodine is pumped in. It gets brought across the cell and then pushed into this follicle, this space, by a carrier protein called pendrin. And from there, it's oxidized. Iodide becomes iodine. Once it becomes iodine, it's single and ready to mingle. It's going to bind up with something, and hopefully that something is the right spot on thyroglobulin. So the first antibody we'll talk about is thyroid peroxidase. And this is the one that oxidizes iodide and activates to iodine. Now, a quick biochemistry trick that can make you guys always sound smart is that ASE on the end of a word pretty much always means enzyme. So this is an enzyme. And an enzyme helps something happen that would have pour enough iodide into your thyroid, some of it will turn into iodine. However, thyroid peroxidase makes it happen much more quickly, much more effectively. And then the body attacking that, that's the antibody, anti-thyroid peroxidase antibody, also called TPO, anti-TPO for short. Yeah, thyroid peroxidase or TPO. Next up, we've got thyroglobulin. So this is the long, complicated protein to which iodine sticks. And the problem with it is that when there's even a little too much iodine, it gets mangled. The proteins become broken, it creates free radical damage, and it harms all the cells nearby. And that's the main thing that recruits in the immune system. It makes the body start to attack the actual protein itself. And that same thing can also cause the attack against the enzyme thyroid peroxidase. So yeah, so thyroglobulin. Now in blood tests, we'll see this as anti-thyroglobulin, sometimes anti-TG for short. There's a whole different test called thyroglobulin. So no anti involved, just thyroglobulin. And that's completely different. That's a marker that just shows the rate of thyroid cell turnover. And normally some thyroid cells are old and dying, and some are babies that are taking their place. So when cells are old and dying in the thyroid, there's more thyroglobulin in the bloodstream, and that's always there. When there's a lot of it there, the thyroid's rapidly growing, there's inflammation, there's cancer, but yeah, it's not the same as anti-thyroglobulin. They both exist. So those are the main two we're talking about. Now, our discussion today will also have relevance to thyroid stimulating immunoglobulin. And that's one of the main antibodies that's relevant for Graves' disease. And with that one, rather than attacking stuff inside the thyroid, it attacks the outside of the thyroid. Think about that like a doorbell. You got a short circuit on the doorbell, you always think somebody's there, even if no one's there. So in the case of Graves', it's as if there's a lot of TSH circulating telling the thyroid to work, but there's not. So even though the body has lowered TSH to compensate for too much thyroid hormone, the thyroid keeps cranking it out because it hears this doorbell going off, even though no one's there. So now we'll talk about if it's important and when is it important to lower the antibodies. You know, and my views have evolved on this over the years, back and forth, but there's been a lot more data in the recent past, and there's a pretty clear trend that yeah, there are circumstances in which lowering them is important. And the first point to distinguish is, in most cases, antibodies are there when the thyroid function is abnormal. So it's important to tease those two things apart, because in many cases, someone can be symptomatic in ways that could improve just by helping the thyroid levels. So there's a lot of times in which the levels themselves could be more relevant to symptoms than just the presence of the antibodies. But the discussion that I'll take moving forward will be, this is when antibodies matter, even when thyroid levels are healthy. So even if someone, say their thyroid never slowed down, never got out of control, or they're on what should be an optimal amount of medication. So in that circumstance, is it still important to lower thyroid antibodies? And the next points will be addressing that specifically, not just are they bad in general, but what happens, what do they do when everything else is where it should be? What do they matter then? So the first point, and this is kind of odd because this is the one that we probably think the most about, is just disease progression. If the antibodies get low, that means your thyroid would get better, we would think. This is probably one of the weakest arguments towards lowering thyroid antibodies because it's not as dramatic as I would have thought. So for example, we can look at someone who has thyroid peroxidase and thyroglobulin antibodies, both over 500 down in this bottom row. And we can see what their odds are. This was basically their odds of disease progression over a 9-year period. So over 9 years, about half of people like that stayed stable, and 31% became hypothyroid, 18% became hyper. But if you go down here and you look at, let's say that these numbers are below 100, so they're both present, but they're both below 100. Well, then we see 11% become hypothyroid, 82% stay stable. So things are better, but they're not perfect. There's still some risk there, so there is some improvement. They really start to matter when we think about symptoms and we start thinking about various health risks that they associate with. So this was a study, it was fascinating. They looked at the way in which certain symptoms showed up and their severity in people with thyroid disease at differing levels of thyroid antibodies. So again, all with stable thyroid function. And a couple of symptoms really showed up as being significant. So hair breakage and thinnage, so hair loss issues, and then swelling and edema, especially at the face and the eyes. So yeah, swollen, baggy eyes, facial swelling, and then voice changes, negative, harsh voice changes. So this study showed that they were the big things that showed up with abnormal levels of antibodies. There was another study that looked at quality of life symptoms. That's this QOL thing. And they did some pretty detailed scores asking about, how's your energy 1 to 10? How's your mood 1 to 10? Things along those lines. And they got a composite of overall quality of life. And specifically in this study, they took some people that had very poor quality of life scores and had high antibodies, and they took their thyroid glands out. And the rationale was that was expected to lower the immune response. And they were assuming that the immune response was responsible for many of the symptoms. So they were bad enough shape, they were willing to consider surgery. And the doctors thought this could be a helpful thing. Now, I wouldn't encourage surgery, and it's not routinely encouraged for someone that's struggling with high antibodies. We've got other options, but this study helped us see exactly how much the antibodies alone contributed to these symptoms. So what they saw is that those whose antibodies went down had marked improvements of persistent symptoms over those that did not. And that was true for overall general health, but the things that showed up most dramatically were fatigue symptoms. This was pretty dramatic. So of people who had just severe persistent fatigue symptoms, if you looked at them after the course of several months post-surgery, the number was much lower. There was about a third that had remaining fatigue. But those that did not, those that were the control group, the number didn't change much. It stayed in the mid 80s to the upper to mid 70s. So the reduction of antibodies, the change in immune response, was thought to be responsible for a really big change in chronic fatigue diagnosis, total fatigue score, and overall quality of life score. So those are some big symptoms. Now we'll talk briefly about health metrics, how this affects just overall health independent of thyroid levels. A big one here we see is atherosclerosis. So there's data saying that those who are, there's a funny word here, EU thyroid, and I was quoting the study. Normally you don't see a dash inside the word, you see it all together. But euthyroid just means stable thyroid levels, stable, healthy thyroid levels. So people that had stable thyroid levels, and good TSH scores as part of that, but had higher TPO levels, had more heart disease show up. They had more plaque buildup. So high TPO can be associated with plaque formation. So if someone has other cardiovascular risks, this can be a relevant thing to consider for overall health management. And another thing we've seen some data on is fertility. And again, we're talking about those with normal thyroid levels. And in this case, both thyroglobulin and thyroid peroxidase were found to be factors for fertility. Now, fertility specialists usually think a little more thoroughly than just most endocrinologists or general practitioners, and they understand that women often cannot get pregnant without optimal thyroid levels. That normal may not be good enough, they may have to be more like in an optimal range, but we now know that even with that, the antibodies can be issues, making conception and healthy retention of pregnancy a difficult thing. So yeah, as far as health goes, fertility is also a factor. And then the last point, which not a slide for, but as far as longer term health, there is data arguing that lower antibodies equates to less of a risk of development of autoimmune disease of other types. So we think about rheumatoid arthritis, lupus, scleroderma, Sjogren's disease, MS. There's data arguing that the antibodies lower makes those things less probable to show up for those with thyroid disease. So altogether, you could say that there's a strong argument for wanting them lower for most people. They could be quite relevant. So in preparing for the talk, here's some things that I thought about. What supplements can help with thyroid antibodies, and how do we know which ones would and would not? So there's the criteria that I considered. The first one is safety. There are products in the market that are commonly adulterated with pharmaceuticals or contaminants or whatnot. And even if they were promising, the whole Hippocratic Oath of first doing no harm, I think that's a good idea. I think it's a really good idea. So yeah, so safety is just like unavoidable. It's gotta be safe to even be considered. Iodine-free, same story. We want to make sure that we're not worsening the whole disease process. Now, this one is interesting, research versus anecdote. So anecdote is someone saying it helped. Now, I want people to get better. However, some things can help in ways that are hard to reproduce. Thyroid antibodies, they can fluctuate. So someone might have taken, a random supplement that maybe it wasn't even related, but that happened to be a time in which their antibody scores were a lot lower. There's times in which things that are not healthy can make your antibodies lower. Someone could have a steroid shot for some other reason, or they could be taking Kenalog, or they could be taking high doses of allergy medications. Do you know that'll goof up your antibody scores? It'll make them falsely low. So someone could do something unhealthy, do some random supplement at the same time, and their antibodies could be zero. That doesn't mean the supplement helped. And there's also times to where the normal fluctuation of antibodies, someone might happen to test, and when they're at their low point, and it might seem like the supplement helped. Or there could be times to where the effect was just idiosyncratic, where it really did help, but that's not typical. Like the person got lucky and had a weird response. And all those scenarios, I'm always happy when someone does better. So I never begrudge anyone anything that seems to be useful for them personally. But what I want to answer is, what can I tell somebody is likely to work for them? What are the best odds of something being useful for you? And that's where we need some quality data to sort that out. And with research, there's a lot of levels of that. There's some what's called research is really just people pontificating their ideas. I think this would work because of this pathway. Or it's stuff that came from test tube studies or animal studies. And that kind of data can be good to form ideas and maybe even like test for some basic safety parameters, but it's not good enough to draw firm conclusions about humans on. Things just often don't work the same way. In fact, they almost never do. So I wanted to base it on things in which there was actual human studies. Like people took this stuff, people with thyroid disease, and they were tracked. And I also wanted to make sure that there was a control arm, because if there wasn't, it could be the case that this group overall had some random change that wasn't from the supplements, from some other factor. But if there's a control arm, there's similar people not taking that supplement, but also being watched. And then lastly, I really wanted to see placebo studies. There are many ways in which we don't trick ourselves necessarily. We can, but besides that, there's a lot of ways to where someone in a study, just by being in a study and being observed, we all do a little bit better. We end up being more mindful of our health overall. We all want to be good students, so we're more apt to report things in different ways when we're in a study. This is human nature. So placebo studies help us to weed through some of that. So I wanted really good evidence. I want to make sure that whatever I was going to talk about was going to be safe, would be compatible with other treatments, was based upon good data, because that way I know it would work. I know there'd be a good odds of it really helping and not just being a fluke. And from the data before about what antibodies can do, this is important. So here's how this went through. So first off, what do we have for nutraceuticals that may affect thyroid function? Well, 89 different things showed up from some literature reviews. I had 89 different candidates to start with. So of those, which are safe? Which do we know are well manufactured and aren't going to have contaminants, pharmaceuticals? That brought us down to 76 that weeded a bunch out. Of those, which are consistently iodine-free? That brought us down some more. Of these, which have some high-quality human research? That brought us down quite a bit more. Now, another big thought, of these, what's not already in a multivitamin? I think a lot about supplements, not just a given pill, but how the pills all interact together. And there's a lot of efficiency in a multivitamin. You cover a lot of bases. So the drawback about not doing so is you get redundancy. And I see this a lot in B vitamins. There's countless products that all throw in boatloads of thiamine, niacin, riboflavin, because they're dirt cheap and they show massive amounts of zeros after the RDA. It's like you're getting a lot of stuff. But if they're in everything, you get far too much of those. So I wanted to make sure that whatever was here was not going to be redundant and overlap with a multivitamin. So that's how I weeded down from 89 down to these top 3. These are things we've got placebo-controlled human studies. They're not going to be redundant with the multi when formulated well. Quality research, safe and effective overall. And first up is selenium. Now, selenium is generally found in multis, it should be. However, the quantities for lowering antibodies are a little bit different than they are for general health. You can go one step higher for that purpose. So this is a good thing in adjunct to a multivitamin. Now, selenium in the thyroid, the roles it plays are just so many. We know that it's needed overall. It's something that we can't live without. And it also forms glutathione. So the earlier picture, it showed thyroid peroxidase and thyroglobulin. They're handling iodine. That's bleach. They're basically managing bleach. And to do so, you need a lot of glutathione. You need a lot of antioxidants to keep your thyroid safe. And making glutathione depends upon selenium. So it's totally critical for that. And they're also a big part of the deiodinase enzymes. And these are the things that regulate all the thyroid hormones in circulation. And without selenium, those can't be formed. So here's one of the example studies that inspired me. Here's the good old Brazil nuts here. And this is funny. So you do want dietary selenium, and it seems that that has some roles that are different from supplemental. So both are important. So I'll talk about good amounts overall from supplemental forms and have a couple of Brazil nuts, eat it in the diet as well. They both serve parallel types of benefits. So in this study, they looked at thyroid status, the volume of the thyroid, and the structure of the thyroid in adults, 35 to 60 years of age. And what they saw was that the selenium itself showed really marked reductions of thyroglobulin and thyroid peroxidase antibodies. And the distinction was pretty big. It was clinically significant. And in some of these cases, it was more than 45%. And the time frame was not all that long. This was an 8-week time frame. So it was expected that even given a bit more time, these reductions could be more dramatic. So yeah, selenium is helpful. And the amounts of it are specifically better in addition to a multi. So you don't want high amounts forever, but a little extra in a targeted way can be a good way to manage the antibodies. So next up with high quality data is inositol. And this is a fascinating thing. So inositol is a carbohydrate / B vitamin analog. It's a wannabe B. want to be B vitamin. Nutrients can be categorized as essential or non-essential or in between, conditionally essential. So essential means we need it and we cannot make it. Vitamin C is a great example. We get scurvy without it. Just a second ago, if anyone's in Arizona, you guys know about javelinas. One just crossed my field of view, and I was tempted to show you guys, but it walked away too quickly. But anyway, one of the many ways javelinas and us are different is that they can make vitamin C, we cannot. So to a javelina, vitamin C is not an essential nutrient. They can synthesize it out of glucose, actually. But we can't do that, so we need it from our diet. But there's a lot of other things that we can make, such as arachidonic acid. That's something that is found in foods. We also do need it to make inflammation and regulate inflammation, but we can build it when we want it. So we don't have to get that from our diet. But then there's things in between to where we need them and we can usually make them, but sometimes we can't, and sometimes we cannot make enough. And that's where inositol lies in this group. It's a conditionally essential nutrient. It's also been called vitamin B8. You know, it's funny, but we had B1, 2, 3, 4, 5, 6, 7 got skipped. So there's all these things that were proposed to be B vitamins that ended up going by the wayside. And yeah, inositol didn't get categorized in the top essential ones, but it was given the spot of B8 temporarily. And it's a compound that's needed for the regulation of energy formation within the mitochondria. So we make energy from that. In the thyroid, inositol is essential for response to TSH. So when we make TSH without adequate amounts of inositol, it doesn't work and the thyroid doesn't know to respond properly to it. It's also a big part of regulating the immune system and making sure the immune system is not attacking the body unnecessarily. It has an overall anti-inflammatory effect, and it's also important for blood sugar balance. And we see this autoimmune disease in general, the more stable one's blood sugar is, the less apt they are to have harm from autoimmune disease. One of the biggest drivers of inflammation is blood sugar going all over the place. So yeah, when it's steady, everything else is great. And those are the things that inositol makes a big difference with. So here is one of the papers that inspired me about this one. This one showed how thyroid antibodies changed when groups were given just small amounts of inositol for, this was also a brief period of time, this was 10 weeks. And what they saw was a reduction of over 50% or greater. And this was true for both thyroid peroxidase and thyroglobulin antibodies. This one was in combination with selenium. Now, inositol comes in a big variety of forms in the diet, and of those, the most common is being myo-inositol. So that's the relevance of it. Next up, we have Nigella. I've got to make a quick note here. Okay. So I just asked Kieran to turn down the stove. I've got a stew cooking behind us, and my nose tells me it's got a little bit more heat than it needs. And I don't want to ruin supper. I want to have a good supper when I'm all done here. So next up is Nigella. And this is cool stuff. I've talked about this before and I've used this before. It's also been called black seed oil or black cumin oil. And it's been used for a long time in traditional medicine in the Middle East. It's been used as a food. You know, it's a culinary oil. It's highly pigmented, so it's colorful, it's flavorful, thus the black portion. Think about like blueberries or like black beans or black rice. You know, these are all things that are highly pigmented. And those pigmented compounds, they've got strong effects lowering inflammation and helping to act as antioxidants and anti-inflammatories. And that's all true for Nigella. We've seen that specifically it's protectant for thyroid cells. It also regulates the immune response, and it makes a big difference for helping cell repair. Now, there's been a couple of really big studies on it specifically and thyroid function. And these have been randomized controlled trials. They were placebo studies. In this particular one, they looked at thyroid antibodies, T3 levels, TSH levels. They also looked at cancerous risks. That's what this VEGF thing is. That's basically how many extra blood vessels the thyroid was forming. And in cases of inflammatory Hashimoto's, we see more risk for thyroid cancer long-term. And the upshot of all this is that all those things got dramatically better in those taking even small amounts of Nigella, but those same benefits did not show up for those in the same study on the placebo arm. So all these lines, all the good stuff that went down was the thyroid antibodies, and the TSH also reduced pretty dramatically. So they were making more thyroid hormone, and they saw T3 levels increase. So many were quite low in T3 going into it, but it got higher. The study also tracked their blood sugar regulation, their overall visceral fat, the amount of body fat they had, and their fatty liver amounts. And what they saw was that those things did better as well. There was less liver fat on ultrasound, there was better blood sugar control, and there was substantial visceral weight loss by adding a small amount of Nigella to that. So when I read these studies, I realized that these were all things that were useful, and this combination could be powerful and helpful. And it hadn't been done before. There hadn't been a mixture made like that before. And I thought that would be an essential thing rather than do all these things separately and be not sure of what they were and what they would be in the amounts. So I put together a new blend for that purpose. And that's what I wanted to roll out tonight. This was a fully custom product. There's a new line called Thyroid Specific Formulations. And I'm making this because so many of these things had never been made before. There's never been a line of supplements made specifically for thyroid function, like formulated totally from scratch. So I'm really excited to roll that out. And the first one I thought was the highest priority was to help with antibodies for all these reasons. So here's what this is and how to make use of it. So dosage is really easy. It's just 2 capsules, and you do that once daily. And we've got therapeutic amounts and safe forms of all of these. Now the black cumin seed powder, this is interesting. There's a lot of subspecies of that. And there was a couple subspecies that were used in clinical trials that didn't work. So I've carefully selected the correct subspecies, as I did for the other black cumin product that I've used. It's important to get the right type. Same story for inositol. With selenium, selenium citrate is a type that's bioavailable, but does not bioaccumulate. So you don't really get too much of that. And that's true for selenocysteine as well, which is the type found in Brazil nuts. So yeah, so the basic idea is just two of those once daily, better with food, and at least an hour after thyroid medication. So yeah, just 2 once a day. This is meant to be compatible with the Daily Reset Shake, the Daily Reset Pack, all those other things. And it's fine for those who are vegan or kosher or AIP, no contraindications that way. Now, in terms of overall facts, yeah, no issues in terms of no grain products, no gluten, and with it, so benefiting the overall response, reducing iodine can help as well, as far as helping antibodies come down more quickly. It's not uncommon when antibodies lower, though, to see changes needed in thyroid medications. And sometimes, if weight loss has been a barrier, we saw before that the antibodies can be factors for that. So some precautions to talk about for supplements for lowering antibodies. The thyroid medication changes is probably the biggest one. If the antibodies come down pretty quick, someone may have a different need for their medication dosage. And you want to be on the alert for symptoms like the most obvious one's going to be a racing heart or difficulty falling asleep or tremors, especially when you're moving deliberately in a certain way and you start to get a tremor. Those can all be signs that if you're on medicine, it might be more than you need now. Your thyroid might be getting stronger and the amounts may not be appropriate. Pregnancy and lactation. So all these ingredients are ones that are categorized, generally recognized as safe, but with pregnancy and lactation, you always want guidance from your doctor about what you can and cannot do. Anticoagulants, beta blockers. So Nigella specifically improves liver pathways, and some of those pathways involve the body's breakdown of medication. So it's possible that when taking Nigella, you could break down an anticoagulant or a beta blocker more quickly. Your body could discard it faster. So just something to be aware of for people who might be on that. And in terms of combinations, yeah, no big drawbacks. This is made to go with a thyroid-specific multi, such as the Daily Reset Pack, and better away from iodine supplements and compatible with all the other things that we've made before. So timing of this. Well, anything you do for your antibodies, really think about a 12-month time frame to get a good handle on that, because they will go up and down. So think about like at least 3 months to look at a change, and about 12 months for that change to really set in and stay stable. And it's smart to think ahead of time because 3 months comes up quickly and it's easy to get distracted and not realize how much time has passed. But yeah, think about 3 months as a minimum block for seeing a change and 12 months for that change to set in and be lasting. And if you're 12 months out and they've stayed lower for that time frame, you can likely have that stay stable by themselves, as long as maintaining some other general good habits. And here's what the other good habits would look like, kind of pulling together all the best from our past talks. Think about the antibody support as the easiest answer for supplements to help. The thyroid reset diet, especially the reset phase. So the iodine regulation is the biggest single factor for dietary change. If you're not on medication, you wouldn't need to start for this purpose. But if you were on medication, the type that's probably the most apt to help your antibodies would be natural desiccated thyroid. And there's been a few papers I've cited that talked about that on the last discussion. Basically, the proteins in it, because they are the same as the proteins in your thyroid, when you take those orally, your immune system sees them more often and your body doesn't attack them as readily. So you can lower your own immune response by ingesting that same type of protein. And again, that's if you're already on medicine. And there are those that don't do well with NDT. In most cases, I think that's a matter of someone not being on a good dose for them or not being stable on a brand. But for some, it's not a good fit. And again, many are not on meds, they don't need it. But if you are, NDT could help the most. So this is a whole new thing. It's a brand new phase, and I'm excited about this being available. And so for those who are here, we're doing a special for the next couple of weeks. You can do auto ship. You can get this with your reset pack for just about the price of the reset pack already. That's a simple one. Or you could do a 3-month supply of this for a pretty good discount and have that first 3 months already covered. I've made this to where it's 2 pills once a day, so not a lot of pills, cost effective, no real icky ingredients. And we're covering these big 3 therapeutic goals, the ones that have human studies showing that they safely lower antibodies. So that's that. And I'll keep this available for you all. I'll make sure you guys get links to this. And I wanted to have some time for questions, and I timed that out really well. So let's grab a few closing questions. And again, I'll go through the raised hands, and likely that'll cover our time. Let me stop sharing. Okay, so now, all right, awesome. We've got a whole bunch of raised hands. I'm afraid I may not get to all of them. So here's the thing. I'm conflicted. I don't want to rush with anyone ever. I want to be thorough and I want to go really deep. And the conflicted part is I want to cover as many questions as I can. So if you're on the deck, if you could do me a favor and just think through a good way to phrase the question. Usually it's a sentence that ends in a question mark with a question at the end. So yeah, just think about that and I'll give you a good answer. I might put up some links with some more depth just so I don't ramble on too long and walk into somebody else's time frame. So yeah, let's dive on in. First, I've got GDGH5. I'm guessing that's not on your birth certificate, but it's on your Zoom. So I'm going to ask you to unmute and lower your hand. Okay, there we go.
All right, can you hear me, Dr. C?
Hey, my apologies, my volume's too low. Let me turn this up. Okay, go ahead and try again, please.
Okay. Can you hear me, Dr. C?
I can hear you just fine. I have my volume down too low. It was my fault.
Thank you very much. Quick one, hopefully. I have 3 autoimmune diseases, and Hashimoto's is one of them. And my concern at this point is just they seem to be additive. Every couple of years, I seem to be adding another one. And I know you mentioned Inositol as being potentially something that might help with that. But is there anything else from either procedural or a medication or anything else that you can think of that might assist with my body seems to just want to attack itself at this point?
Yeah. We're totally aligned right now. That was the whole focus of these last 3 talks, is how do we calm this whole autoimmune process. So did you catch the other 2 by any chance?
I did not, but hopefully I can go back if possible.
You sure can. We're going to make those links readily available. That was the Cliff's Notes, is the thyroid reset diet. Are you on thyroid medication?
I am, yes, 90, and I'm on NP thyroid because I can't find Nature Thyroid or WP. So
Yes.
I'm in Florida. I used to be one of your patients for many years in Scottsdale, but unfortunately I'm in Florida right now.
Okay. Yeah, so you're on NDT. You've got that covered. One thing that I did mention as well, vitamin D sufficiency. So it doesn't mean you got to be swimming in vitamin D, but you don't want to be deficient in that. So in the States, we generally see our blood levels in nanograms per mil. And probably the sweet spot to cut your risk of developing autoimmune disease would be somewhere in the upper 30s to the high 40s, low 50s. So you don't really want to be like massively high, but you don't want to be deficient. So that's a big
Okay.
factor.
Thank you.
And then last thing, which I did mention, the first one too, was about really having an abundance of anti-inflammatory essential fats in the diet and avoiding the pro-inflammatory fats. So the main pro-inflammatory fats are saturated fats and arachidonic acid. And the anti-inflammatories are going to be EPA, DHA, and also omega-6, believe it or not, ends up having anti-inflammatory effects. So, yeah. But check out those other talks. I went through all that stuff in much more detail.
Got it. Thank you.
You're welcome. Okay, I'm going to mute. And we've got Karen up next. A couple Karens here. This is Karen Knight for our first one. I will ask you to unmute, Karen, and I will lower your hand and go for it.
Okay. I want to ask about my A1C and ALT because
Yeah.
they fluctuate between like A1C between 5.6 and 5.9. My ALT goes between the mid-teens to the mid-20s.
Mm-hmm.
Is this thyroid related, and how can I get it stable in an optimal range? I don't need to lose weight, but
I missed that for a second. You said you do or you do not need to lose weight?
I do not need to lose weight.
Okay. Are you familiar with the metabolism reset diet concepts?
I've heard you talk about it, but I don't have the book yet. So I was wondering if that's something I should pursue.
That's the best fit. You know, a little earlier today, I did an Instagram live with one of my doctors, and she was talking about a case study of someone who pretty much what you described. This person also had higher cholesterol. She was pre-diabetic, and she did have a few inches she wanted to lose, but she really could not otherwise. But she didn't really have much weight that had to come off. And she did follow the metabolism reset diet. We do a challenge every so often, but you can do it whenever. And yeah, she reversed all those things and then some. So A1C, that's your hemoglobin A1C. So your red blood cells have a ring on the outside and glucose sticks on them. They live about 3 months. So it's roughly a 3-month average of blood sugar. But even more important, it's how blood sugar hurts us, because when it's stuck to the red blood cells, it gets them jammed up in the wrong places. So not only is it a handy measurement, but it's the exact way that high blood sugar is harmful. And you're right, I'd love to see your scores come back in the low 5s, high 4s. And that's exactly what the metabolism reset diet is all about. So jump on that. We've got a super active Facebook group, which is totally free, Metabolism Reset Diet on Facebook, and lots of good support in that. But yeah, jump on into that. Check your scores right after, because those things can change really readily for people. If you are on thyroid treatment, please do consider about that being optimized in some way. That can help it go better. But yeah, MRD can turn that around really well for you.
Okay, thank you.
You're welcome. Thanks for being here. Okay. Aisha, I hope you can come on and help me out and help me pronounce correctly. So I'm going to ask to unmute, lower hand. And how close was I in the ballpark?
It's Aisha.
Aisha. Oh, much more simple than I was making it.
Yes.
Thank you for that.
The spelling is hard. Can you hear me okay?
I can hear you just fine. You're doing great.
Okay. So my question is, I'm always the one that's always asking about Graves' disease. So I don't know if you consider me still having Graves' disease. I got off all my medication this past summer. So I guess I could just say I'm in remission. I don't know if that's an actual thing, but I'm really curious about this. Yay. So I'm curious on how long you stay on your supplements, or should you take a break from your supplements every so often?
Yeah, so in your case, I highly recommend the Daily Reset Pack. Do you know about your thyroid-specific immunoglobulin levels? Do you know if they're being monitored at all?
I don't know the numbers. When I got off my medication over the summer, I was going to wait a little bit longer before going back in to kind of see my numbers after I kind of watch what I'm eating and all that kind of stuff, but I don't have the numbers off the top of my head.
You know, so TSI, and the way to remember that is TSI is one step away from TSH, right? So if you turn the I sideways, you got an H, they're almost the same thing. So that's the main antibody relevant with Graves. It's not uncommon to have TPO up as well. And if your blood marker showed that both those antibodies were negative, I wouldn't bother with this, but I would stick on the daily reset pack. That's still a good fit for multi-support. That's not something you would need to cycle. That's just foundational, essential micronutrients. There's nothing it really makes you lazy about. You don't have to like stop it and start it. But yeah, keep tabs on those levels. If those antibodies were up, then this would be a good fit. That can help those keep you from likely having Graves come back again. So yeah.
Okay. So even on your thyroid bundle, do you ever take a break from them for a little bit or just keep taking them?
Yeah, those are essential nutrients. They're fine to continue.
Okay. Okay. Thank you.
You're welcome. Okay, Jess, we got Jess up. Asked to unmute, lower hand, and go for it. You know, it's easy to get distracted. So if someone is not on, I'll move past and have you raise your hand again. But going, Jess. Oh, didn't mean to raise hand. Okay, no problem. Fly Girl, you are up next. Asked to unmute, lower hand. Let's hear what you got.
Hi, Dr. Christensen.
So are you a pilot or?
No, flight attendant.
Okay, that's cool. Welcome.
Thank you. I have your book, and for the last month, well, when did it come out? A couple of months ago. For the last couple of months, I've been on the thyroid reset diet, and I'm currently on half the dose of thyroid meds that I was prior to going on the thyroid reset diet. So I'm doing quite well with that. Yeah, and two quick questions. Prior to going on the diet, I was taking krill oil because it really seemed to help my joints a lot. And I discontinued that when I went on the diet, but I can tell the difference. And I walk and jog a lot, and I would like to be able to go back on the krill oil if you feel that wouldn't throw a monkey wrench in my progress.
You know, I don't know about the iodine content. So the benefit of that is that it's a source of EPA and DHA. Now, compared to fish oil, the amounts that it has are extremely small. So it takes a pretty high dose of krill oil to approximate the milligrams of EPA and DHA that you would find in fish oil. Both those products, the risk is just iodine as far as sea products. Now, most fish oils that I've checked in the recent past have been acceptable because you don't use a large quantity of them. So with krill, you've got to use a larger quantity, and there's more of a risk of ending up with more iodine than you would need. So yeah, we the daily reset pack, we've got fish oil in that, and we do assay that for the iodine content, and it's low. We also keep a separate fish oil which is an option. And then in the book, I talk about some lower iodine seafood options, but you should be able to get the same benefit. A really funny paradox about the EPA and DHA is that the more fat you consume, the more EPA and DHA your body requires for the same purposes. And that wouldn't make sense otherwise, but there's an enzyme called delta-5 desaturase. And that's the one that your body uses to make other fats into essential fats, specifically alpha-linolenic acid, which there's a ton of that in flax, a lot of that in hemp, also in chia. Your body makes that into both EPA and DHA. If you're on a moderate to high fat diet, however, that enzyme is so busy with other fats, it can't convert into essential fats as readily. So if you're consuming overall a healthy diet that's just lower in unnecessary fat and a good amount of fish oil, healthy foods in general, you'll have plenty of EPA and DHA, which can give you those same benefits.
Okay. Okay, well, thank you so much.
You're welcome. Yeah, thanks for coming tonight. Okay, let's get caught up and muting Rosette. It's a pretty name I've not heard before. Rosette Gonzalez, asked to unmute, lower your hand, and go for it.
Hi. Yeah, I'm calling on behalf, thank you, by the way. Um, I'm calling on behalf of my mother. She's 85 years old and her TSH scores were 8.06.
Okay.
T3 was 3.3 and her T4 is 0.9. And her doctor keeps wanting to put her on thyroid medication and she doesn't want to do it. She's a naturalist. About 6 years ago, she was on thyroid medication for a little while. She hated the way it made her feel anxious and just, yeah, she just didn't like it. So she was on it for about a year. And then she went to a different doctor and they checked her levels again and they were so borderline. She said that they said, you can either take the lowest dose or not at all. So she decided not at all. The only other thing to note is that last year she had a stroke. She's on Eliquis now, a low dose of that. What happened from the stroke was pretty minor, just some right side vision loss. I noticed that she had been taking multivitamins that had iodine in them.
Mhm.
So I've since given her your book and she's devouring it as we speak. And I would just like her to retest again after getting that old multivitamin out of her system
Sure.
because of the iodine. It was only like 30 micrograms or something
A
like
lot of
that.
it is, should she be on
But
thyroid
if she does, I'm sorry?
So mostly it's like whether she should be on thyroid treatment or not?
Yeah, the question is that, and if the results come out the same, what additional tests should she take? And is there a more natural way to approach this for her?
Yeah, and you're totally right in that just going on the lower iodine regime is the best way to start out. Her situation right now would be called subclinical hypothyroidism. She's not below range in free hormones, but her TSH is between 5 and 10. And you didn't express any obvious symptoms, so it sounds mostly like subclinical disease. And there's a lot of debate as to whether it helps to treat someone like that if they're not symptomatic. And it's not clear, and it's also different with age. So at 86, there's not really a clear medical urgency for her to be on treatment in that case. If she were symptomatic in a way that was better with treatment, that would be fine, but there's not a medically urgent reason to treat otherwise. So if she is symptomatic on treatment, if it feels like it's too much, that wouldn't be necessary. But she could well see improvements by following just some of the basic guidelines in the diet. So you're exactly on the right track. I would move forward with that.
Okay, great. Thank you. I think she'll appreciate hearing that.
You're
Thanks
super
so much.
welcome. Okay, Joanne's up next. Hey, Joanne, how you been?
Hi,
Hey there.
I've missed the last couple of office hours lives because something always comes up, like my daughter calls and she lives an hour away. So anyway, I've been missing you terribly. I've been missing you terribly. Okay, my two questions are, with your new supplement that you just unveiled, I have Hashimoto's. At this point, my daughter does not. And I've given her all your materials. She's eating Brazil nuts every day now. She's cut out eggs. She's doing everything right. Would this be something good for her to take as a person whose TSH is, everything's good right now, but she's trying to take the steps to avoid getting Hashimoto's?
As far as preventing them from coming on, I wouldn't ever do what she's already doing, do those things well. There's no harm to adding this in, but there's just no data I know of saying that it would help. So yeah, and this is, I'm never going to push things that are not specifically helpful or proven to be useful, and it's just not proven to be useful in that case. So I think the things that are doing are going to go a long ways towards that, and I'd have to just keep up with those.
Okay, great. Second question. This whole past year during COVID lockdown, I've exercised 3 times a week faithfully.
Good.
Cardio, and I do the weightlifting because I know I have osteoporosis. I've had it for years. Do the high antibiotics contribute to that? The fact I have Hashimoto's contribute to that? Because I'm pumping the weight, but yet I still lost more bone mass this past year too.
Well, yeah, so, and this is interesting because with thyroid medications, they always talk about warnings of osteoporosis. And the truth is, if anyone is overdosed, it is a problem. But assuming you're not overdosed, it's not a factor. It wouldn't really drive that. So yeah, keep up with the weights. Even think about daily for some kind of cardio, even like a basic walk. And how are you doing on your protein intake? How are you doing there?
Oh, I'm fine. I out-eat my husband. I've a good diet.
You know,
But I'm still underweight. I'm still underweight.
okay. So strength training and specifically squats, that exact exercise has the most benefit.
I do a
So,
lot of squats. I do a lot of lunges.
okay.
So just keep doing what I'm doing, basically.
Keep doing what you're doing. Yeah, bone density is hard to track at less than 2-year intervals with the DEXA study. It's just not accurate more quickly than that. But almost all cases when someone does those basic things well, they can see improvement. So I wouldn't give up on that.
Yeah, I've not seen improvement, and I've had about 4 DEXA scans over the last 8-9 years.
You know, well, one last thing you could consider that I've seen in some cases. So calcium gets a lot of attention and it's part of things, but any mineral is needed for good bone health. And there are some people that they're great on everything, but like one random mineral, they have none of that. Like they're very low in, it could be manganese, or it could be zinc, or it could be copper. So there are red blood cell mineral assays available, and those can be helpful tools to see if you had some weird mineral deficiency like that. So sometimes there's like one missing link for someone. And for sure, I'm seeing comments come up about vitamin D. And you mentioned, I know you're doing a lot of those basic things well already, but some people need one mineral in amounts far apart from what they would ever get by normal supplementation. And if that shows up, they need a very high dose of that particular one for a set period of time, remeasure, make sure they're stable, and then back to baseline supplementation. So just one next level you could think about.
Okay, so a red blood cell assay, is that like something Dr. Espinal could order for me? Because I'm meeting with her in about a month.
She sure can.
All right, wonderful. Thank you.
Blood cell mineral assay, yep.
Okay, good to be back.
Good to see you, Joanne. Take care. Okay, how are we doing? We're doing good. Let's get a couple more here. Iris is with us. Iris is here. So there she is right there. I see her in the top left of my screen. So.
And how do I get rid of my hand? Okay.
There
So, hi. I'm so
Hey
glad
there.
you picked on me. Okay, so I have a whole bunch of questions and I talk very quickly. I'll try to slow down. I've had very high antibodies. I've had very high antibodies for a long time. My TSH is a little bit high, but I feel great. I have a lot of energy. I really don't have symptoms as far as I can see. And my doctor and I have decided to not treat me. So one of my questions is that such a bad thing? I get very, very healthy eater, lots of protein, lots of, fruits and vegetables. I take supplements, and my supplements have 100 micrograms of selenium and 150 of iodine. Is that too high? Are you supposed to get no iodine?
Yes,
I don't know.
You're supposed to get no iodine.
No iodine. Okay. Now, is it bad for me to not be treated in any way?
So in terms of, are your thyroid levels stable, but it's just the antibodies that are up, you're saying?
The antibodies are really high. In my blood test, the range was 0.4 to 4.5, and I was 4.8.
For your TSH?
For my TSH. Everything else is right in the middle, but my antibodies are
Grab the new book. You probably wouldn't need thyroid medication, but some of the basic iodine avoidance ideas, you could probably see your scores do a lot better from those steps. The TSH being on the high side, you can feel fine from that, but it does create some medical risks for you. So longer term heart disease risk. Actually, an odd thing people don't think about is melanoma. There's a high risk for melanoma, several types of cardiovascular disease. So it's kind of like having high blood pressure. You don't always feel it. So I'm glad you have symptoms, but you should address those scores. Yeah, really.
Okay. So you think maybe your vitamins might help that, because that would take me off the iodine completely.
Yeah, go on the reset pack and go on the antibody support. That combination would be perfect for you.
Okay.
Cut out all the
The only other issue I have is I have MTHFR. So now I need a particular kind of folate, and I'm not sure that you have that in your vitamins.
Yes. Yep.
Yes, you do?
Yes.
Yay. So it's not
Yeah.
folic acid. Okay. Now, would this
No,
also be good
goodness
for
knows.
somebody with Graves? My daughter has Graves, and would this also be good for her to do? Should she be no iodine also?
She should be avoiding the iodine. She'll need treatment to slow her thyroid. But
She is, and she feels great on the medication.
yeah, so with that, regulating iodine will make it go much faster for her. She'll get to success much more quickly.
So these vitamins would help her as well.
Correct.
Okay, I guess that is, so I do need to treat this. I guess that's a takeaway. I really need to lower my antibodies and my
It's awesome that
TSH.
you feel well, but I want you to feel well like 20 years later too.
Yeah, okay, so treat it. All right, well, I'm gonna get your book and I'll get all the vitamins and go off what I'm doing then, and that should help, hopefully. We'll see. And then, so once you start them, when should you go get a blood test? Like,
3
let's
months.
say
3 months for tracking the antibodies.
3 months. Okay, will do. Great. Thank you for picking on me. Yay.
I love your pace. It's great. I play my podcast and audiobooks at triple speed, so this is fine.
Yeah, right, I do. I do speed everything. I can't understand it when it's fast. I can always say it fast. Okay, thank you.
Okay, Paula, let's see what you got. Go ahead.
Hi.
Yes, hey, Paula.
Hi, good to see you.
Good to see you too. It's dark there, but I can still see you.
I always happens like that. I'll see if I can get some more light.
Oh, it's fine. I'm just teasing.
Yeah, I'm on the East Coast.
Okay.
Thank you so much for all of your work. I'm always inspired. I just have a bunch of questions, but I'll see. The one thing that came to mind as we were talking in this hour was for the antibodies, of course, and asking to get them tested. I've received a lot of resistance with the doctors that I've seen, and it's been quite a few actually. They keep saying if you've been tested once and there's positive antibodies, then you don't need to be tested again. But I keep trying to push for it because I'm curious to see kind of where things are at. It's been for me over 10 years, I think maybe 15 years now, since I was first diagnosed with Hashimoto's and the positive antibodies. So I guess wondering about that, how to kind of proceed. And then I guess if it's okay to ask the secondary question is it was mentioned about thyroid medication increasing anxiety. And
Sure.
I've definitely noticed since I've been taking Synthroid, I'm on Synthroid, that's increased over the years. And I never had that before. So I wondered, I wondered if that was connected, but I hadn't heard too much about it before and what I could do aside from changing, because I've looked into natural thyroid medication, but again, I've had a lot of resistance. I can't seem to move forward in that either. So,
So one rule that I've learned that addresses both of those, it's a lot easier to change doctors than it is to change a doctor. Not that it's easy to change doctors, but it's darn near impossible to change a doctor.
yeah.
So there's that. As far as checking the antibodies on your own, which state are you in, or which area are you in?
I'm in Canada.
Okay, I don't know the regulations as far as self-ordered testing, how that works. In the States, many can order their own blood tests if they wish. Not in all states. So I know in New York, there's more restrictions that way, but that may or may not be an option for you. I'd be curious to find out about that. But yeah, there's that. And then just seeing if there's someone who does fit with your beliefs more so in your area. As far as thyroid meds and anxiety, so any kind of thyroid medicine, if the dose is not great for you, you could feel more anxious from the wrong amount of thyroid levels. And I'd think about the dose before thinking about trying to change medication. So if your TSH were below somewhere around 0.4, a really high percent of people would feel anxious. And then the further it gets above, somewhere around 2, sometimes that can happen as well. So there's that. Now, the other thought is that there are times to where the amount of types of thyroid hormone, T4, T3, and T2, that can be a factor for anxiety. And some people do better if their medicine includes all of those. And that's the natural thyroid you were talking about. So sometimes T4 only can be a factor, but even more commonly, the dose is a driver. So if you're on a bad dose, you may not even need to change medicine. It might just be a matter of correcting the levels. And the other thought is that embarking on some of these things that we're talking about here, your needs could change a lot. It'd be very surprising if they did not change quite a bit. So you might even bundle up some of your checking a couple months down the road. If you've not already jumped on the thyroid reset diet, you can do that just fine in Canada. And in a few months, your needs could be very different than they are now. So yeah.
Okay. All right. Thank you so much.
You're welcome. Good questions. Tony, I've seen your name around a bunch of times. Welcome back, Tony. How you doing? What do you got?
Hi, can you hear me?
I can.
Okay, awesome. Yeah, thanks for calling on me. I discovered your practice over a year ago, and I'm currently seeing Dr. Espinal, which has been great. And I have Hashimoto's. I'm not hypothyroid, but I have nodules, and so I'm on NP thyroid because to help, I guess, just kind of give my thyroid a rest, because the reason I initially even got my thyroid checked was because I was feeling a lot of inflammation in my neck and thought something's going on there. So it discovered that I have 3 nodules. My antibodies, when I had them tested, over a year ago, they were over 700. I only have the thyroid TGB antibodies. I don't have
the thyroglobulin was way up.
Yes, yeah. But now it's like been cut in half. So it's going way down, which is awesome. And I think so my biggest concern is that I want to decrease these nodules if possible. And I have been getting ultrasounds once a year. I had my second one in December, and so far there isn't any change. There's nothing's bigger, but nothing's decreased yet. So would your supplements that you're offering be helpful for decreasing nodules?
This particular one is not formulated for that. So I'll get scolded for this. I suck at secrets. I've got a few more coming out soon. One of them is specific for nodules.
Oh, okay. Because that's awesome. Yeah, because that's my big focus. Is I have inflammation going on and those nodules, but my TSH wasn't really elevated when I initially got tested, but I discovered that I had higher antibodies. So I think being on NP thyroid has helped. Like I don't feel that inflammation anymore.
Yeah, so nodules, stay tuned for one coming up in the next month or so. Also, yeah, keep working with your doctor, stabilizing your thyroid scores. That's important for the nodules. I don't know body weight. If you're at a good weight, that's awesome. If not, even a few pounds difference can actually help with nodules. A lot of data on that as well.
Okay, that's good to know. Thank you.
You're welcome.
Okay. All righty, bye-bye.
Bye-bye. Melissa D. Let me re-mute here. And so the javelina just went by again. I didn't want to cut Tony off, but I thought about showing you guys. They're really unusual. Melissa, go ahead. Let's hear what you got. If you're still with us, and if you're not in the other room, Melissa, we're waiting for you. Okay, we'll come back if we can. Going. Yep, okay. Angela, you're up. Let's see what we got here.
Hi, Dr. C. Can you hear me?
Hey, Angela, I sure can. How you doing?
Hi, good. I just bought your Metabolism Reset diet book, and I also got the daily reset shake as well. And my question is, I have hyperthyroidism. Is it safe for me to have the daily shake twice a day, just add a water with it, and will that still be working well?
And you did say hyperthyroidism, right?
Hyper, yeah.
Yeah, no problems with that. I'm assuming you're on some treatment for it right now as well.
Yes, I'm on PTU.
Okay. You're at some stage of pregnancy, or you didn't do well with methimazole, or?
I think I am on. I'm not pregnant right now, but I've been on PTU for like 16 years since I was like 15 years old. And it's been working well for me. That's what I'm on right now. Okay.
In most cases, methimazole is preferred over PTU, with the exception of pregnancy. But if you've been on that, it's been stable, that's reasonable enough. But yeah, the reset can be a good thing for you. consider the daily reset pack in addition. And there's actually a hyperthyroid support coming out pretty quick too. But if you have really stabilized and you do things well, and also if you're aware of the iodine sources, you wouldn't likely need the PTU long term. There's when someone's TSH is kept from being too low, they're no longer hyper, there's about a 95% chance within 18 to 24 months that they don't need ongoing treatment for Graves' disease. So the odd thing is that, hypo, Hashis, they're no good. The rate of reversal is somewhere, without any treatment, is about 25%. And with good treatment, like we've talked about, it might be a bit higher. But Graves' disease, when it's stabilized, the rate of remission is higher. So it's more dangerous in the short term, but it's more common that it goes away when it's treated effectively. So yeah, most don't need treatment for that long. So I'm glad you're stable, but you can sure do those things safely. And yeah, you might not need treatment for indefinitely.
Okay, sounds good. But I can take the daily reset shake twice a day, no problem, right?
No problem whatsoever.
Because I do see there are some of those like supplements kind of high in percentage, like Selenium. I don't know how to say the word, but
Selenium.
I'm just yeah. So
No,
it's fine.
My thought with all that stuff is that pretty much, I'm assuming everybody's got thyroid disease. I'm always formulating things with that in mind. And I'm assuming that could be Graves or Hashimoto's or nodules. So yeah, no worries that way. You're in good shape.
Okay, sounds good. Thank you, Doxy. Have a good day.
You're welcome. You too. Okay, Amanda, you are next up. Let's hear what you've got. And let's see if we can't get in at least 3-4 more. Go for it, Amanda. Amanda.
Hi, can you hear me?
I sure can.
Good. Hi.
There's some rock song with Amanda in the name. I was trying to remember what that song was, but it wasn't coming to me. You guys are lucky you didn't hear me sing it, so go for it.
I so appreciate all of your the research that you do and how you communicate it to those of us in the thyroid world. Thank you. I have a question. I think you actually touched on it a little bit with one woman when she mentioned that MTHFR gene, which I also have. And I have been taking, well, prior to doing stuff with your thyroid, I'm on your personalized thyroid plan as well. And I've been following along the program. But prior to that, I had Wentz's MTHFR supplement, which has an enormous amount of folate. And I'm wondering your thoughts on that just wondering your thoughts on that.
Yeah, that's an awesome question. And my views have evolved on that quite a bit. Ben Lynch has written a lot about this topic, and he and I did a joint podcast or a joint webinar a few years back, and I've bounced these discussions back and forth with him. We were on a long hike about a year ago and went through all this stuff in crazy detail. So the thing that you guys never hear, and I'm glad you asked it, I can share this with you. There's a huge line between having a gene and expressing a gene. So there's gene status and gene expression. There was someone that I was speaking to a few days ago, and she had an extremely high level of homocysteine. She was like 24 or so. And she had horrible food cravings and had never heard about the ways in which homocysteine affects serotonin and how that affects food cravings. And so we talked about that. But she had normal MTHFR genes. So MTHFR affects how we methylate. However, you can have all the genes that aren't ideal and you can do a great job at methylating. Or you could have none of the bad genes and just suck at methylating. And that was her situation. So the most obvious sign of a methylation problem is blood cells that are way too big. So on a blood count, that's called the mean corpuscular volume, the MCV, and they elevate. That's one of the most common signs of poor methylation. Having MTHFR genes doesn't mean that you're a bad methylator. It does mean that you're wise to avoid folic acid, but there's an idea that's gone around that means you need mega doses of special types of folate. And it's not true. That can be counterproductive. In some cases, you're better off with less amounts in total B vitamins. So yeah, the main action step is to avoid the synthetic folic acid and have a healthy amount of dietary folates. All your leafy greens, nuts and seeds, beans, legumes, intact whole grains. They're all rich sources of those. And then have a basal amount of methylfolate in supplementation. And that's what we put in the reset pack. It's also better to use methylated B12. And finally, it's better to avoid synthetic B6, which is pyridoxine HCl, and focus on pyridoxal 5-phosphate. If you're on the reset pack, you've covered all those bases just fine. But yeah, there's really nothing past that that's important. Now, if someone does have high MCV and or high homocysteine, there are more targeted action steps, but those same action steps are actually counterproductive if someone did not have those. So yeah, you're probably covering your bases just fine already. Did that make sense? Did you? You must have been muted. Okay, no problem. I think I covered that one. Estelle, let's get you and a couple more here. I'm going to ask to unmute and lower hand and go for it. Estelle, can you hear me?
Yes, can you see me?
I can hear you and I can see you. You got the lovely red glasses on. There you are.
Hi.
How you doing?
Okay, that's proof. Thanks. Oh, I've got a ton of questions here. Okay, let me just think. Just recently, about 3 or 4 weeks ago, I got diagnosed with NASH, the non-alcoholic fatty liver disease.
Sure.
And this is kind of a new shock because I thought I was doing everything very healthy. And I've had Hashimoto's, I think it was first diagnosed in about 1997.
Mm-hmm.
So I don't know how long I had it before, because I probably had it longer than that, because for a long time I was feeling thyroid symptoms for many years. And every time I went to the doctor, they said, I'm okay, nothing's wrong. So I don't know how long I've had it. But anyway, some questions that I have, I'm going to jump around a little bit. I've been, right now, I'm taking Levoxyl and liothyronine. And that's, I chose these two because prior to that, I think a few years ago, I was taking Thyroid, and I was having trouble getting it because they kept running out and it was a problem, so I thought, forget that. So I'm thinking, what is the best way to do that? Which are the best thyroid drugs to take?
Well, so I would think about the amounts as being really important. I do see advantages for natural desiccated thyroid for those who do well on that. Thyroid was one brand of that. And over the years, I've gotten less attached to a given brand and more concerned about people not changing brands when possible. So we've got NP that many have talked about tonight. We've got Armor that's available and pretty consistently on the market. But yeah, many do better on NDT over T4 alone, sometimes even better than T4 and T3 combinations.
Yeah, I tried taking Armor for a while, but it was difficult to cut the tablet in half because it kind of crumbled. So that's why I stopped taking Armor. And also I didn't feel good about getting drugs that come from pigs in China, because I'm not quite sure how clean they would be and how toxic free it would be if it comes from China.
Sure, there was a window of time 2 years ago where NP had one source of raw materials that was from a US approved manufacturer in China, but that practice has since stopped. So as of this point, there are no US products that are made from Chinese raw materials. That was a concern, and I would share your concern that way, but that's no longer a consideration and it won't be moving forward.
So do you think that synthetic like Levoxyl and liothyronine are just as good as natural?
I think there are those that do better on them and many do well on them, but there are some important differences still. So there's T3, T4, and there's also T2. And there's also many other active thyroid-like compounds, many thyroamines that are present in natural thyroid. And we did a study showing that those on T4 and T3, comparing their basal metabolic rate to those on NDT, people could burn 300 more calories per day on about the same dose of NDT. So there are some advantages that it has, but no one thing is a perfect fit for everyone. So yeah, good questions. And about the fatty liver, if you're not already, please take a look at the Metabolism Reset diet materials. That's really all about helping fatty liver.
Oh, sorry, what's it called again?
The Metabolism Reset diet. There's the book, there's the Facebook group, but that's really specific for helping fatty liver.
Metabolism Reset Diet. Okay, I better just write this down so I don't forget. Yeah, I saw that there was a webinar on it recently and I just missed it because I didn't go to my email for a few days, and then I came, I don't know who was doing that. It was some kind of fatty liver summit or something like that. Do you know about that? It was a few weeks ago.
No, just check out the book that covers those bases real well. So yeah, good questions.
And also, and regarding NAC, what's a good amount of NAC? Because I didn't see that mentioned earlier today, that NAC is also supposed to reduce thyroid antibodies and acetylcysteine.
Yeah, I'll stop on that one and grab the next question. So N-acetylcysteine, there were papers on it, but not showing that it was consistently effective, and no human studies. So that did go through my list of supplements that I considered, but it did not make it. I just heard from a friend today on a phone call that NAC may be removed from over-the-counter supplements in the near term. So it may not be available in the near term anyway, but it was not one of the ones that was shown to be effective in human trials. Nothing bad about it, but it just didn't have data showing that it did that in humans. Okay, Vanessa, and we'll get a couple more here. So Vanessa, you are up. Let's hear what you got for us. Vanessa. Okay, we're gonna go on. Donna, you would be up next, and let's hear from you. Okay, Donna, go ahead.
All right, thank you. I've never ever heard one of your webcasts or whatever they're called, and this is my first time talking to you. I have systemic lupus and Sjogren's and fibromyalgia and interstitial cystitis.
Oh.
And every time I do blood work or urine, lab work, usually about 18 things come out abnormal. And I see a rheumatologist, a urogynecologist, the family doctor. I've seen hematologists, and I've seen a nephrologist, and I have a new appointment with a nephrologist again due to these abnormalities. But I also have 7 thyroid nodules, one which is larger than the others, and they keep watching it to see if it changes. So far, it hasn't changed, but if it gets any larger, then they would investigate cancer, thyroid cancer. I guess my question is, with all of these autoimmune problems, do I need to see an endocrinologist? Do I need to see a naturopath? And what kind of doctor are you? I live in Gilbert, Arizona.
You're in Gilbert, Arizona. So myself, I'm a naturopathic endocrinologist, and I oversee the doctors at Integrative Health. And that's our sole focus is endocrinology. And yeah, we manage thyroid disease exclusively. So we'd be happy to help out with that part of it. And thyroid disease is the most common of all autoimmune disorders. And as a generalization, the better it's managed, the better the arc is for your other diseases, and the less your likelihood is of having others show up. So it is important to be well managed for your thyroid, and we'd be really honored to help with that.
Oh, thank you. I will definitely look you up. And your integrative health in Scottsdale. Do you have other locations?
We do not.
Okay, well, Scottsdale's close enough. Thank you so much.
You're welcome. Best wishes to you, Donna.
Thank you.
Okay, so this is cool. So I've been seeing someone who's been waving all the time and smiling and trying to get my attention. And I've been making sure that even if she was out of order, I probably would have gone anyway, but she's up next. So this is K8. So let's go for it here. Okay, so I can't hear you just yet. Still no.
You got it.
Now we got it. All right.
It gave me a pop-up. Let me see if I can see you. I don't see you, but let me get back to the main screen. So couple of quick questions. I have Hashimoto. The first time visiting one of your lives, so this is great. I've always thought you were looking forward to your products and investigating the Facebook page and all of that. But I have been Hashimoto since '99. Back then, I had to fight with my physician to get the antibody test. She just told me your thyroid's broken. I gained 60, 70 pounds, went into a whole metabolic syndrome thing. No one understood what was going on. I have been managing the thyroid for a while, but I have a type 1 mom, and from that autoimmune diagnosis, found out we have a whole bucket of autoimmune in our family. So been doing everything I can to avoid the gluten and all of those things. And this past year hit the pandemic craziness and was eating terribly and gained a lot of weight. And I did Virta Health to try and reverse the diabetes numbers that were getting kind of bad. And I have done very well on Virta Health, but I don't think that high fat diet, ignoring the microbiome and all of that, has been playing well. And I do have 2 nodules. I have a brother and sister that they've taken out their thyroid. They did not get tested for antibodies, but I have a sister that had Graves, and I have a brother that I think was probably Hashimoto's as well. Mm-hmm. But my question is, I don't know what to do. I bought my own calcium artery score last summer, and I wish I hadn't. Oh, but what was your score? I have high LDL. And I have a cardiologist that had a fit, or lipidemiologist actually, who had a fit that I was on Armour. And I actually drive to Cleveland Clinic's New Functional Medicine Institute. It's about 4 hours from now to get Armour, because I kept being told I need T3, but I couldn't get anything else than Synthyroid. And I knew early on to go off of the synthetic if I could and get on a natural thyroid. And the only way I could do that was to go through Cleveland Clinic in 2014. Now, he's got me thinking that what is the relationship with thyroid and cholesterol numbers? And I do have some blood sugar issues, and I have a type 1 mom who had a type 1 brother and sister, but there has been no confirmed antibody tests. And I'm trying to tweak. I noticed that at the beginning of the pandemic, right before I started Virta and doing the whole keto mess, I got really low TSH. I got all my numbers kind of went wonky on my thyroid, which I'm assuming that keto and all those types of metabolic diets, though they're great for the blood sugars, they're not great for the metabolism. So I'm looking forward at looking at your metabolism reset program, but I'm trying to figure out what is your line of attack for when you have blood sugar dysregulation. And the only thing that's really been working for me is the exercise. So I've been trying to keep up with that. Yeah. But I'm starting to think that was Armour a good choice? And it's interesting your comment about staying on the same med and looking at, I can't get T3, and my endocrinologist has said he would never give me T3 unless I was pregnant. And the last thing that just happened this last year is I went into menopause, and I don't know how menopause, everything I'm researching on it is not a good factor for the heart disease, the cardiovascular, the diabetes. Sure. They want me on the statins that are going to raise the diabetes number. That's going to do, I'm just caught in this really big conundrum, and I don't know what to do. Should I look at doing a different thyroid med?
Yeah. So awesome question. So a couple things I'll address there about the relevance of T3 in cardiovascular disease, cardiovascular risk, about the whole high-fat diet approach. So big issue is that if you're overdosed on any kind of thyroid medicine, that's like the worst thing in the world for your heart. It's super dangerous, and I've seen so many tragedies that way. There's a group that I'm forming that I'm just about to announce, and our goal is to train doctors to not do things that hurt people. So yeah, that's a big deal. Now that does not implicate natural thyroid or T3 with T4 when they're used in responsible fashions. There are things that your body makes already. They're not foreign things that can hurt you. So if what you're taking is in the type and the amount of what your body would do, that's not a bad thing. So it's safe to use. It's not safe to overdose, and that's true for any thyroid medicine. As far as the fat approach, there are those to where they may end up lowering their total food intake. They may get more satiety by keto. So far, the comparative studies in controlled settings show that a high-fat diet causes less fat loss than a lower fat diet on the same amount of food. And the reason for that is we need carbohydrate to burn fat. So the old adage has been fat burns in the flame of carbohydrate. So yeah, so we use glycogen to burn triglycerides via a chemical process called beta oxidation. So ketosis is actually not when the body is burning fat. Ketosis is what happens when we cannot burn fat because we have no carbohydrate to help burn fat. We can't burn it, so we make it into ketones actually. And blood glucose gets lower on ketogenic diets. However, blood triglycerides get higher. And they're really the same thing. You know, fats, carbs, ketones, they're all oxaloacetate. They're all energy molecules. And triglycerides are not better to have in high amounts than glucose is. So in terms of thyroid function, yeah, the data is very clear that ketogenic diets really slow the thyroid. Kids don't get a lot of thyroid disease. It's quite rare, like 1 in every 1,200 pediatric patients gets thyroid disease. But when kids go on ketogenic diets for epilepsy, which it can have some benefit with the epilepsy, but when they do that, 27% of them need thyroid treatment. Their thyroid slows that much. So it's a big deal that way. And your comments about the microbiome are just point on. They're totally valid. There are things that can help some blood markers in the short term, but we have no data saying that those extreme diets help your health in the long term as far as cardiovascular health or overall health. So yeah, I think you're thinking of those things in the right way. But yeah, your T3 is a safe option for you. So good questions. Let me ask to unmute again, just a quick follow-up comment if you can. Go ahead.
Unmute, okay, two-step process to unmute. I'm 4'4", I'm ApoE 4'4", so I'm trying the Bredeson's program, which would put
wow. Yeah, you do not want a high-fat diet. That's not safe for you at all. You're the last person to do that.
I'm really confused because I've been paying for Virtus programs, so I am testing ketones and all of that, but my gut has been telling me this is the wrong approach.
No, that's the most dangerous. You're the worst possible candidate for that. That's the most dangerous thing to do. Just to be very candid.
And not just to add more to the storm, what does menopause do to all that? What is the loss of estrogen? Because they want to talk to me about high hormone replacement therapy, and I think that's just going to make everything even crazier. But I'm most concerned about maintaining muscle and muscle building because I had a weak moment in leg strength, and I know the only thing that's really helping my blood sugars is exercise.
Yeah.
So menopause does to all this, but it probably adds.
So valid concern. Basically, it raises, actually menopausal change by itself lowers thyroid binding globulin, so your body gets more thyroid responsive. HRT can work against that. HRT can make you more thyroid resistant again. I would focus hard on just healthy, good diet. Take a look at the general dietary guidelines I talked about in the thyroid reset diet, and also metabolism reset, and then apply the specific therapies as far as doing a metabolism challenge, doing low iodine. But think a lot about the general health measures I mentioned. They're all ones that are heart healthy for you and compatible for an ApoE4 genotype. So good one. Okay, last one. I got a family that's walking around smelling the stew that's been cooking, and I think I'm about to get mutinied if I don't serve that pretty quick. So I could be here a while, but I'd get a pot across the side of my head if I did that. So let's get Robin from St. Louis, and she'll bring us home. And yeah, come on by. Most Mondays I'm on Facebook, Instagram Live. I'm happy to grab more questions then. But Robin, let's hear what you got for us.
Hi, Dr. Christensen. Thank you so much for all your sharing your expertise. Hi, I've been on Armor Thyroid for many years and doing pretty well on it. I feel pretty good. But a couple of years ago, after I went into menopause, I got on hormone replacement therapy with compounded estrogen and progesterone. And the practitioners gradually talked me into inching up my dose of the female hormones, saying that it would really help get my thyroid in balance. And it seemed to, something got it in balance.
Okay.
But my question on that is, they've told me I can keep taking the hormone replacement until I'm in my 60s, early 60s, I guess. And I'm 58 now. So I'm kind of wondering, am I going to have to worry about my thyroid going back out of balance if I start notching back off the female hormones eventually?
Yeah, good question. I'll give a little more depth about that in menopause. This is an important one. So HRT can be safe. It can be helpful. It can do a really good job for managing symptoms of menopause. Early along, there's a group called the American Anti-Aging Association, and I was with them in '95 when they first started. And so I kind of saw that world evolve and grow. Many in that world have the idea that giving hormones makes us not age in the same ways. And that's really not supported by data anymore. There were some theories around that back when, but that's not, there's just, you can't say that with solid scientific integrity any longer. You can safely manage hot flashes and night sweats, no debates about that. But as far as side health benefits, that's not really panned out. So if someone is having hot flashes and night sweats, and they're not managed by general healthy measures, in many cases they can be. In many cases, simple things like weight loss, improving thyroid function, healthy diet, good nutrients, those things can often help a lot. Caffeine and alcohol are huge drivers towards menopausal symptoms. But for sure, there are those to where the symptoms persist otherwise. And there are those where the symptoms do not respond to hormones. So that can happen for some, but they can be safely used. So let's think about estrogen, progesterone, testosterone. So testosterone, no big effects upon thyroid function within reasonable dosing. Progesterone, subtle effects on the thyroid, generally slows it, but sometimes can be more neutral. Estrogen pretty much always slows it. And there's a thing called thyroid binding globulin. Actually, I spoke with a friend who's preparing a presentation, a 2-hour presentation for doctors on this very topic. And the evidence about estrogen doing that is just no debates. I mean, it just does. And when someone does add estrogen, whether it's natural, synthetic, oral, topical, troches, sublingual pellets, or even oral contraceptives, and they're on thyroid meds, they're probably going to need more thyroid meds. It's just totally normal and totally expected. Now, it doesn't mean that it's harmful to their thyroid per se. It just means their body will not get by on as little thyroid hormone as they used to in the past. So when they go off of estrogen, the opposite of that happens. Now they'll need a little bit less again. So I can't really think of any scenario in which if you chose to discontinue your hormones, it would make things worse for your thyroid. If there's estrogen in your mixture, you'll likely need a little bit less thyroid from stopping, but no, it won't make anything any worse. I wouldn't worry about that at all. So yeah, one less thing. So good to see you guys tonight, and quick recap of our series. The first one we talked about diet. Biggest single factor is iodine. Other factors are going to be adequate protein, healthy body weight being a big driver for antibodies. We talked about medications, not too little, not too much, all things equal, natural does the best. And we talked about supplements. And 3 things there are safe, are effective, multiple human trials show they worked. And I put those together for the antibody support blend. And that's the selenium, the nigella, and the cumin extract. So you can lower antibodies, you can do better, and it's worth doing for most people. So yeah, thanks for being here tonight. Good to see everyone. And let me just take a quick look and see if the Javelina are out there. Nope, it would have been fun to show you guys. These things are pretty weird. But I'll be back again soon. We'll do more webinars like this. They've been really a lot of fun. And yeah, more goodies to come from thyroid-specific formulations and lots more information on the way. I got a cookbook that I'm starting to get going on that'll be coming out in the near term, and a new organization I'll announce in the coming days. So lots of good stuff and lots more options. You can feel better, never give up. Always know that it's capable to feel your best, have your body work better. Never settle for anything less. All right, have a good evening, you guys. Bye-bye.